Hello, today we look at the side effects of clozapine. We know that clozapine can be given to patients who have schizophrenia and that are resistant to other antipsychotics, and therefore we call it treatment resistance. Then we give clozapine. We know ultra resistance would be a resistance against clozapine also, and that is the next step. We will do another video about that. So, clozapine now, which are the side effects? We want to give clozapine because we want to help this patient with schizophrenia, but the patient has a lot of side effects from this clozapine also, so we need to have that in mind, and therefore we never start with clozapine because clozapine have many side effects actually, and therefore it's important that we start always with other antipsychotics, and if they don't work, then we go on with clozapine. And now, which are these clozapine side effects? The most dangerous ones, and these are, for example, granulocytosis. Granulocytosis means that we have no granulocytes. Granulocytes are the white blood cells of your body, for example, neutrophils, and we always start with the blood sample before we start clozapine, because then we can see the neutrophil count, and then we see that the neutrophils are more than 1,500 cells per microliter. Then we can start clozapine. Otherwise, you don't start clozapine. Then you need to consult with a hematologist and a psychiatrist, and then we can maybe give clozapine in these cases. We know that neutrophils are very important. That's the immune system of the body. So don't mess with the immune system of the body. So if you give clozapine, then please stay above 1,500 neutrophils per microliter. That's one thing, agranulocytosis. And I dealt with another video also discussing what happens if we give clozapine and during the treatment it drops. So it was more than 1,500, but now suddenly it's 1,000 to 1,500. In this case, we continue clozapine, but we monitor the level 3 times weekly. What happens if it drops less than 1,000? Then we stop the treatment, wait until it becomes more than 1,000, and then we continue the treatment with regular monitoring. What happens if it drops less than 500? Then we stop the treatment. We consult with a hematologist and psychiatrist, and then we evaluate if the benefits are outweighing the risk of clozapine. And then we give clozapine again. Because as we know, schizophrenia is a very severe disease. The patient can commit suicide, the patient can harm other people. So always benefit-risk ratio has to be looked at. Good, that was agranulocytes. What about heart? We have, for example, myocarditis and QT prolongation here. We start with QT prolongation. This means that in ECG, the electrodes that we put here can see that we have a graph, we have a P wave, and Q or S wave, T wave. Between Q wave and the end of the T wave, this is the QT interval. And if that is more than 500 milliseconds, then please don't give antipsychotics. If it's more than 450 milliseconds, then you can give antipsychotics, but you need to watch out. If you see that the level, this millisecond is increasing more than 20-30 milliseconds in a very, very short period of time, then you really need to watch out. Never reach more than 500. So up until 480, 490, then you are in the gray zone. And why is this important? Because if you have QT prolongation that is too long, you can get something called torsades de pointes, and the torsades de pointes can actually kill the patient. So watch out, that's QT prolongation. What about myocarditis? Myocarditis. Myo means muscle. Carditis, card is heart. Itis is inflammation. So we have muscle of heart inflammation. If you define it like that. If you define it more beautifully, you would say it's an inflammation of the heart muscle. Okay? Itis, inflammation. And what happens here? Before we start clozapine, we always check the regular parameters, ECG, we make even echocardiogram to check the heart function, we measure the enzymes in the blood to check any levels of troponin. Troponin is an enzyme that can be seen increased when the heart is damaged. So we check the troponin levels, we also check the ECG, as we said, and we do an echocardiograph, we check the CRP, that is the inflammation marker, and if it's more than 100 milligram per liter, or if the troponin is more than 2 times the upper limit, then we can see that this is maybe a myocarditis. But that is after clozapine treatment. Before the treatment, we check the level, and then we can change the level. How much did it increase or not? Therefore, we do it once before clozapine, and then we do it during the treatment. And if we see the patient has also symptoms of myocarditis, for example, fever, for example, tachycardia, meaning increased heartbeat of more than 100, general symptoms of fatigue or so chest pain or dyspnea, meaning difficulty breathing, and all these parameters, so more than 100 milligram per liter CRP or more than 2 times the upper limit of troponin, then you can say that this is myocarditis. And this is very common actually. I say very common, then I say 0.2% around. That means 2 patients out of 1,000 or 1 patient out of 500 would get the myocarditis with clozapine. What about agranulocytosis? How many people do you think would get that? Around 0.8 So that means almost 1 in every 100 patients would get granulocytosis. So these are very common actually. When I say very common, then I mean, of course, 1 in 500 or 1 in 1,000 and so on. Okay, metabolic side effects. Metabolic side effects are what? Lipid increase, meaning all the cholesterol, triglycerides and so on increase. And this also have to be checked before we give Clozapine, because then we can compare before and after. Or diabetes mellitus can happen. This is also metabolic. Diabetes mellitus. 34% have been shown in some studies that patients with Clozapine get diabetes in 34%. So it's very, very high. Also we have weight gain. 10 kilo to 15 kilo in a range of this has been seen. So the patient takes Clozapine and then he gains weight around 10 to 15 kilograms, around 30 pounds. So all these things are important. Why? Because if you have these diseases now, diabetes and so on, atherosclerosis, then you get heart attacks, then you get stroke and so on. So the schizophrenic patient will now die instead of stroke or die because of diabetes mellitus. So we have solved the schizophrenia, but now the patient gets all these other things. And therefore it's important that we have prophylactic measures for everything. The patient needs to exercise. The patient needs to eat a healthy diet. Fruits, vegetables, more fibers, more fluids. Exercise. Why? Because not only these diseases are benefiting, for example, constipation, which is a side effect of Clozapine also. Constipation, meaning that the stool is not going, the bowel movements are not moving as they properly should. Therefore it builds up a lot of stool in your bowels. What happens then? You get really problem. The worst case that could happen is adynamic ileus. Ileus means that the bowels are not really moving and it is totally blocked. And if it's blocked, then you die. If you cannot release all the sluggish stool that you need to remove from the body, then you die. You get a toxic reaction in your body. You die. Or you get it up in the stomach region. And now don't get afraid, but you need to have prophylactic measures here, laxatives. You need to give laxatives to these patients if you see that. In 14% of cases, we will see this constipation. Adynamic ileus is very, very rare, but you need to have laxatives, high fiber, that is good for constipation, a lot of fluids, which is good, and exercise. Exercise. This patient needs to exercise. Then, what more do we have? Seizures. Seizures can happen. Yeah, you need to have anticonvulsant medications also, prophylactically, in some cases. Not for all cases. What I mean is, maybe a patient with Clozapine will now get a seizure one time. Then you start with anticonvulsant. You don't need to start all these prophylactic things that I'm mentioning. Because we have, for example, pulmonary embolism. Thrombosis is happening. Increased thrombosis risk for patients with taking Clozapine. That meaning you should prophylactically then take statins and aspirin. Aspirin and statins, for example. When we deal with receptors, in order for you to understand, there is something called H1 receptor. Clozapine can act on H1 receptor. That can cause sedation. So this is a side effect of Clozapine. The patient will be so sedated. They are calmed down, they are sedated. That's due to H1 receptor. If it acts on the alpha-1 receptor, it will cause orthostatic hypotension, meaning that the blood pressure drops. Orthostatic hypotension due to the alpha-1 receptor activity of Clozapine. So you see, appetite changes, appetite increase due to Clozapine acting on 5-HT2C receptors. 5-HT2C receptors. So all these receptors that the Clozapine is acting on cause the side effects, but not for all the patients. So when I'm listing all these side effects, it does not mean that every patient will get that. Some will get it, some will get 1, some will get 5, some will get 3, depends on the patient. Depends on the dose we need. Depends on which dose of Clozapine we give. We always start with the lowest dose, of course. Then we have something called prolactinemia. I will not deal with these specifically, I will deal with that in other videos. Prolactinemia is an increased prolactin level in the body, and that is also not good. I will not deal with why and so on, we will take that in that because it will be too long. Then we have neuroleptic malignant syndrome. Neuroleptic malignant syndrome, this is a very dangerous state. I will deal with that in another video. And as you see here, I'm listing all these side effects. And why? Because I want you to appreciate why we give Clozapine in the end, when we have tried everything else. And this is the last thing we try. Then we try this one. Okay? Urinary incontinence, anticholinergic side effects, because we know Clozapine is an anticholinergic also, meaning that anticholinergic is just a pathway in your body, and that can cause, if you block it, it will cause then what? Urinary retention, dry mouth, constipation as we saw here, and so on. What more do we have? Extrapyramidal symptoms, tardive dyskinesia. The good thing about Clozapine is that it's causing less of these extrapyramidal symptoms or tardive dyskinesias. We'll deal with that in another video, what that means. But what I want to say is, every antipsychotic can cause extrapyramidal symptoms and tardive dyskinesia. The clozapine one is causing less of these. Also, less of neuroleptic malignant syndromes. The risk is less actually with clozapine. It's higher with other antipsychotics, and so on. So I think this will be enough of side effects for the moment. So I want you to look at this video many times because it's very, very hard to memorize otherwise and understand. And I want you as a doctor or you as a patient to always watch out for these side effects, and whenever you have the side effect, then you talk with your doctor and then you adjust the dose accordingly and so on. Thank you very much for listening. Have a nice day. Bye bye.